Hi there, welcome to Ambi Talk, the AIR sessions. I'm Ronan Cooney. In this series of interviews, I'm talking to experts in academia and industry about air, the importance of the air we breathe, the impact on us of the everyday environments we live in, and how the world is and will continue to change post-COVID-19. Schools have been on the front line really of the pandemic pretty much from day one, and much has been politicised about the closures and safety for students and staff. In reopening them and closing them to begin with. So to discuss this and a bit more, I'm delighted to have Mairead Murphy, Principal of Balrothery National School in Dublin with me. So hello Mairead.
Hi Ronan, how are you?
Good, thanks. And thanks for taking the time out. I know we were just talking there, it's a difficult time for teachers and principals in particular, with the uncertainty, I suppose, and things changing all the time. So I appreciate the time.
That's no problem.
So maybe, Mairead, you might just give us a quick overview just about yourself and your background and how you ended up where you have at the minute.
Yeah, well, as you said, I'm the principal there at Balrothery National School, and we have 329 children. We're a vertical school, so with junior infants all the way up to 6th, which is 12 classes, and we also have 5 SEN rooms. We have a staff there of about 26 people. That includes the secretary, the caretaker, 12 class teachers, 6 SEN teachers, and we also have 6 SNAs as well. So about 28 staff. We have another girl that comes once a week as well. So, you have a reasonable amount of people there working in a building and in any one day, which is good. So that's really the general background. We're a small village, so the community is relatively small there in Balrothery, but we're still serving 329 children, which is a considerable amount of bodies in a room.
Yeah, definitely. And I guess if you can remember back to when the pandemic sort of came out, or COVID became a well-known word, just what were your sort of main concerns, I guess, with the school and how you were going to handle that from the start?
Yeah, well, the main concerns would have been the transmission of the virus, obviously. So initially, your main concern, I suppose, from a management point of view, was keeping your staff safe, that COVID didn't come into the school. And an awful lot of that had to be around communication with parents, that they had to take on board not to send their children in. There was a whole sea change, we'll say, we generally had an open door policy. But with COVID, then we have no access to the school building whatsoever, other than the teachers and the children that are there on a daily basis. So they were the biggest challenges at the beginning, to get your systems in place, get your PPE ordered, your one-way systems, your pods in the classroom, setting up your classroom bubbles. Then there was a whole system had to be set up around special education. So we tried to minimize the movement of different teachers through different classrooms. So if you can visualize, some children go out for learning support, some in-class support was happening. So we had to allocate certain teachers to certain rooms, and they were the only people that were ever allowed to enter those rooms. Again, if COVID came in, then you were minimizing the amount of disruption to the whole school. So you could actually identify the close contacts. Same with the staff room, we had to split the staff in half. We had to stagger the yard. So some people now don't see each other on a day-to-day basis, because they're actually on a completely different timetable. So quite a lot of logistics have to be set up. The main worry is, and the main aim is, not to let COVID come into the school, and from management point of view, to keep your staff well, basically. So they would have been the main things when we were coming back there in September.
And have you been fortunate enough to not have any cases in the school to date?
We had 2 classes had to go home. So we had one junior infant class that went home in September. I think we were only 2 weeks back or something. And there was one child diagnosed with COVID, and then the questions were asked by the HSE, were they in pods? And of course, junior infants, they're in theory in pods, but they're not in pods because they're infants and they're moving. And so anyway, that whole class was sent home, as was teacher, as was the SNA working in it for the 14 days. And then in October, we had first class were sent home again. And then that was the whole class gone. So not too bad though, you know, 2 classes, we were happy enough that it was only 2 classes, and thankfully nobody was very sick, which was the main thing.
Yeah.
You know.
And I guess from the start there was a lot of guidelines from I guess the department must have driven really opening the windows and things like that, and keeping all the windows and doors open, and I guess there was a fine balance between getting that ventilation and then, you know, temperatures and stuff and getting into winter. Do you find that difficult to sort of manage? And
that was a massive challenge, because we were okay in September. Everyone was very happy to leave the windows and doors open, no problem. But when we got into November there and December, and there was the cold snap and it was miserable, people really started to complain, staff and children, that it was really too cold, and wanted the windows to be closed. And it was, you know, the COVID officer, their own, was very vigilant, going around and reminding people that you actually have to keep the windows open. But it did cause conflict within the staff, you know. It definitely caused a bit of bother.
And I suppose, you talked sort of briefly, just the impact on staff and that sort of social element and having to keep everyone apart more and stuff, I guess has been difficult. But did you find, like that, to begin with initially, I guess not knowing and not having actual data was a difficult part of that you weren't able to make data sort of decisions, you know, you were just blindly sort of following rules, I suppose. So.
Yeah. And I mean, the Department of Education set out, keep the rooms ventilated, but like they didn't quantify the ventilation. So I've got different rooms, I've got prefabs, I've got rooms that are in the main building, and completely different airflow situations. So the department gave a loose guidance, but it was never going to guide us in each school's setting. You know, it was only guidance to see. It wasn't a detector. It didn't give us any scientific numbers to work on, you know. So, you know, that was difficult. Yeah, definitely.
And do you felt that has changed at all, or is there more of a discussion about ventilation at, I guess, principal level or department and stuff like that coming?
Yeah, I actually think there'll be more of discussion now on ventilation. I actually think there is a need in schools to monitor the air quality. Because it will inform opening and closing of windows and doors. And that in effect will save money for heating, and, you know, from the long-term finances of a school, it would actually save us a lot, with or without COVID. If we knew the air quality was bad, open your windows, you know, it could be very useful, Ronan, going forward.
Yeah, and I think that's the thing of, it can be hard sometimes to look beyond COVID, you know, and all that, but again, having that data about, you know, potentially like colds and flus and stuff all being spread through, which is basically just the same sort of impact, you know. Do you think then that schools will start more, I guess, more monitoring of their, you know what's actually going on in classrooms, and like that, like you were saying, ventilation or airflow, or have more school building, and, you know, you've obviously loads of information about staff and students and all that, but the school itself, I guess, has never been really an area that was covered, I guess, previously. Yeah.
I mean, everything that we get from the schools is via grant, and every grant is allocated against a certain thing that the grant is supposed to be spent on. I would wonder, going forward, will ventilation become part of that? You know, or it's called COVID PPE grant at the moment. So will something come in under ventilation and air monitoring it won't be called COVID, but it might be called a health monitoring something for the school, you know. I could see something happening in the future.
Yeah, because it's something we've seen with other people like office spaces, and there's this whole sort of sick building movement. You know, if you might have heard of that, but where usually people, you know, that are working in it, but I guess it applies to everyone, become sick from the building that they're in. You know, and like that flow and light and all these sort of things become important. So it'd be nice to see schools to follow on with that, and I guess have some sort of plan around it, or assessment at least would be good.
Yeah, because even with the systems that we have in place for COVID-19, we had less colds and flus anyway, and I had less teacher absenteeism than I've ever had, I'd say, between September and December. Now, that's a dual thing. People didn't want to not come in because they knew their colleagues were going to have to, you know, take up the reins. because it's impossible to get a sub. But I do think probably on the whole, because we had the windows and doors open a lot and we were washing the hands and doing all the rest, that we were actually healthier for it. Yeah, and definitely the ventilation helped there, keeping the windows and doors open, definitely.
Yeah. And do you think things like that then, I suppose, again, looking sort of later on this year or sort of post-COVID, that the behaviours and habits that schools will change a lot, you know, and take a lot out of this and move sort of things on a bit, or what do you feel about that?
No, I think schools will. I think we've all learned a lot now since coming back in September. And definitely, I mean, in the past, you sometimes never see a window open in a classroom, you know, depending on the teacher, really. If the teacher was a cold creature, there's not a chance of a window being opened. Whereas now, you know, the general thing is to have your windows open. And I'm sure that will follow through going forward. The other thing, from the children's point of view, we bring them out to play now, hail, rain, sleet or snow, they're out. And teachers are out supervising as well. Again, it's all much healthier. It's a much more healthier way of living. And it's what the Scandinavians have been doing for years. So, you know, I do think being out in fresh air and having good air quality in your working environment is something, Ronan, for the future, definitely.
The Scandinavians always seem to be ahead of the game.
They do, don't they? They're very annoying. Yeah.
And I suppose just finally, Mairead, just do you think like the role of technology then has sort of done enough for schools, or do you see it that it could do more, I suppose, in the future to help with some of the things that we've been talking about?
Yeah, I'd say technology. Sure, look, you can see there we're teaching learning technology is at the core of it. So, you know, I would imagine everything going forward is going to be linked with technology. So just like that, your monitoring of your air quality. Yeah, I would imagine it's going to be linked, definitely.
Yeah, great. Okay, Mairead, well, thanks again for taking the time out today. I'll let you get back to it. I'm sure you have a busy schedule this evening. Yeah. I know a lot of people think schools stop at 3 or half 3 or whatever.
Oh, yeah.
There's a lot of after hours.
There's a lot of after and ins and outs and all the rest. It's good too, Ronan. We can't complain.